So my name, okay.
There you go.
I'll just start again by introducing myself. So my name is Pauline Huang. I am a traditional Chinese medicine practitioner, and I will explain in a second what that means because that was kind of a question that came up before we started the recording. And I practice in Ontario, so I serve all of Ontario virtually. I also have some local patients as well who would come in person for acupuncture. And just a bit about my background and why I'm passionate about cancer care. So I grew up in a family where sort of a severe illness made an impact on the whole family. So my mother was the one who was facing the severe illness. Um, but it did have kind of a ripple effect on everyone, including around stress levels, even sort of like conflict, relationships. And I'm very passionate about supporting everyone in dealing with that. So maybe you're the one facing cancer right now or in the past, or maybe it's a loved one of yours, but it really impacts everyone. And I think the more folks in the household or in the circle of close, loving supports can have access to information or resources to help them, the more again, the benefits ripple out to everyone. So I've also come across Chinese medicine first in dealing with my own health issues, both physical and mental health, and it didn't really occur to me to study it. But then when I started to study it, I was told that my grandmother had been a practitioner and she passed away when I was young. So while my father is actually a biomedical doctor, my grandmother practiced traditional Chinese medicine. So I think there was some kind of, connection there. Um, I want to explain a little bit about, I guess, the training background. So that was a question that came up for those of you who just joined. That was a question that came up about 5 minutes ago about what is the difference in training and schooling between different types of health modalities. So I'll talk about kind of the Ontario context specifically. So the questions were around like massage therapy, chiropractor, and traditional Chinese medicine. So these are all different regulated professions at this point. There's a number of regulated health professions. So you may have heard of like naturopathy, for example, or naturopathic medicine. That's a different one. Or psychotherapy, that's a different one. So massage therapy is a regulated health profession that's a distinct, like it's a different profession than traditional Chinese medicine. Now it gets a little confusing because traditional Chinese medicine practitioners also learn medical massage, and it's called Tuina massage. So it would be massage on the basis of the traditional Chinese medicine way of looking at the body. And a lot of the moves are actually kind of similar. So historically, the Swedish massage that massage therapists use drew a lot from traditional Chinese medicine massage. But at this time, they're regulated separately. So if you're looking for like a registered massage therapist, that would be a different type of schooling than traditional Chinese medicine. It also gets a bit confusing because chiropractors, which is a totally other, so that's a totally other branch of like schooling and training. Chiropractors and massage therapists are able to take kind of an add-on training of acupuncture onto their, a scope of practice. So chiropractors typically do a lot of like spinal manipulation or that sort of thing. Um, and they can take kind of a short course. So typically they're required to take like 200 hours. Chiropractors, massage therapists, physiotherapists, nurses, etc. And they can add acupuncture on, but just within their scope of practice. So typically chiropractors and massage therapists can add that on for musculoskeletal issues. So that means pain. Pain, tension, that kind of thing. But acupuncture for, let's say, like insomnia, for hormonal issues, etc., that's kind of outside of their scope of practice. I don't know if that makes any sense. I know this was Joanne's question. Oh, I don't even know if she's here right now. Oh, there you are. Anyway, if you have follow-up questions about that, let me know. But let me just say, because I will talk a little bit about Chinese medicine, so that might kind of also clarify. Um, okay. So when I say, if I say TCM, if I ever say that by accident, that means traditional Chinese medicine. Okay. So for me, again, I'm a traditional Chinese medicine practitioner, which in Ontario actually kind of includes registered acupuncturist. So you get the registered acupuncturist training after 2.5 years of training full time, dedicated to acupuncture. So it's not just like a weekend course, it's like a full-time course for 2 or 3 years. And then if you continue to study herbal medicine, then you get the registered traditional Chinese medicine practitioner level. So I'm both of those things. And then I also did a 3 years master's degree in China, which focused on cancer care. So that was on Chinese medicine, but related to cancer. Okay, yes, AJ Pal.
Yeah, there was one more question in the chat.
Yes, I see that. It's about
Perfect.
post-surgery.
Yes, there you go.
Okay, great. So keep dropping the questions in and I'll try to answer them. So that was the one about training. So I'm going to get into the presentation. It's going to include a bit of talk about traditional Chinese medicine, in which should address a bit of that training question. As a general disclaimer, of course, everything I talk about is general information and education. It doesn't replace getting assessed and personal information from a practitioner. So, traditional Chinese medicine has a very long history of at least, 2,500 years known. So there's a lot of old manuscripts. We use classic um, assessments about how to maintain your health and about acupuncture, maps on the body and things like that. This is actually very old stuff. It's been going on for at least 2,500 years, but it's also very modern. So it's continued to evolve. There are universities dedicated to this with different specialty departments, including on internal medicine, including on oncology. Um, and this is the school I went to for my master's in Chinese medicine with a focus on oncology. And this is a hospital that's a focused Chinese medicine hospital in Nanjing, China. So again, they have all the different specialty departments, gynecology, surgery, breast surgery, oncology, etc., orthopedics, whatnot. And there are different branches. So this is where it gets a little confusing. As I was saying, there is some massage within traditional Chinese medicine. But just in Ontario legally, there's a different licensing for massage therapists. Some people have both licenses, some people just have one or the other. And then there's some overlap, like around nutrition or herbs. There's a bit of overlap with like naturopathic medicine. So uh, naturopathic doctors learn a number of different things, homeopathy, etc., and they learn a little bit about Chinese medicine as well. Yeah, so I know that acupuncture came up in many people's questions. So this is a branch of traditional Chinese medicine. And when we do acupuncture, it's not just for pain or tension, although it can definitely help with those things. But as I was saying before, it can also help with things such as hormonal regulation, hot flashes. It can help with uh, digestion, sleep, stress, anxiety, mood, etc. So that's one way in which acupuncture by a registered acupuncturist differs from acupuncture by a massage therapist or a chiropractor, for example. Another huge part of traditional Chinese medicine that we'll talk about today in terms of survivorship is herbal medicine. So that's the use of plant materials, typically also some minerals, um, to help to balance the body. And we'll talk a little bit about some of the benefits for cancer survivors. You have probably heard of Qigong and Tai Chi. If you're familiar with Wellspring, they have those programs. I highly encourage you to join. So, all of these have been traditional ways of maintaining health in the body or dealing with disease and illness. And they've also continued to be updated throughout the years and researched. So there is actually quite a bit of research into all of these interventions and their benefits for people with cancer or for cancer survivors. Okay, so just some examples of this modern research and modern use of herbs. So, for example, one of the Chinese herbs was the basis for a anti-malaria drug, which won the Nobel Prize. And she actually looked at the classic preparation of the herb when she went to um, kind of invent this medicine that was based on the plant. There's also been a lot of research into combinations of herbs that we traditionally use in Chinese medicine and how they may complement cancer treatments. So that was also in Nature, which is a pretty big scientific journal. Okay, so traditional Chinese medicine oncology then is basically it's a branch of traditional Chinese medicine. So there may be many traditional Chinese medicine practitioners near you, and they may have different levels of knowledge about oncology specifically, so you can ask them about it. Um, so usually to actually really specialize in this, you do have to do some further training. Like I was mentioning, that's why I put the 8 years, because in addition to the 5 years of basic we do in Ontario, I did the 3 years masters, and typically we don't really specialize till we get to that level. Oncology acupuncture then would be a branch of acupuncture that focuses on using acupuncture to support people with cancer. Uh, and These days, we are finding that it's very common to see Chinese medicine, especially the acupuncture branch across North America, but the herbs as well, we're seeing in some leading hospitals in North America and around the world. Like less so in Canada. Canada is very conservative, so it tends not to have as much integration with Western medicine, but certainly in Europe, in the US, and in Asia, of course. And again, there's a lot of research going on into that. So I keep repeating that just to make sure you know that it's
It's
not
not.
just
I think I'm gonna just.
that it's not just sort of people are coming up with this out of nowhere and it actually has no positive benefit for people. It's being researched to show that, when there's benefit and when there isn't. So when would we use it? So there were some questions about post-surgery. So, and we're talking kind of a focus on survivorship today. So for sure, after surgery or after other active cancer treatment is over, um, then we would use Chinese medicine to recover from the effects of the treatment, as well as then ongoing in terms of maintenance. So the strength of Chinese medicine and other forms of complementary and integrative medicine tends to be that we focus on the rest of the person and not just the tumor. So a lot of times people are saying, when they go to the oncologist or the surgeon, there's a lot of focus on let's, get rid of the tumor, let's get rid of the cancer cells, which is, of course, very important. But then what about the rest of the person? So a lot of integrative medicine will focus on, um, well, why did that cancer, grow in that environment to begin with? Is there anything we can do to affect the rest of the environment? Is there anything we can do to focus on quality of life? So some of the things that Chinese medicine can do, I divided them into these three kind of categories. So there's kind of the palliative or soothing element. So let's say after surgery, you have some pain, or maybe there's fatigue, then there can be this kind of relieving of discomforts. That could be mental or physical discomforts. A lot of times, after active breast cancer treatment, people might still be on hormone therapy, or maybe there was surgically induced or chemotherapy induced menopause. So there could be hot flashes and night sweats. That's another thing that Chinese medicine is quite good for. Um, and then uh, when it comes to the strengthen side of things, this is actually a very common issue that people come to Chinese medicine for in the survivorship phase, because Western medicine doesn't necessarily always have a lot to offer in terms of boosting up the body, boosting the immune system, improving the energy. Whereas Chinese medicine has a long history of using tonics. Like how many people here have heard of ginseng? Yeah, that's pretty famous, right? So that's one of Chinese medicine's more famous herbs. Or maybe you've heard of reishi mushroom, chaga mushroom, turkey tail. Maybe you've heard of astragalus root. So all of these are very well known, but we actually have a lot of other ones. So tonifying or strengthening the body is one of the main benefits of Chinese medicine. And main kind of like unique strengths is these very strong tonic formulas. So after surgery, for example, I would use probably a different formula than I was using pre-surgery, depending how the person feels. And we would help recover from the surgery because usually we say in Chinese medicine that surgery causes a bit of a loss of qi and blood. So there was a bit of a blood loss. It was a bit of a trauma to the body in a sense, obviously for good reason. But to recover from that, there's often a lot of tonics. If there's some pain, we may use some herbs to help with, um, we call it moving the blood circulation because trauma can often cause the blood to kind of stick and stagnate as well. And then we'd also use, some anti-cancer herbs as well to help with whatever might still be circulating around. Blood counts, for example, that can go down after treatment. We can help with those. Astragalus is probably the most famous herb that tends to be used for that. And then the other herbs, we'll talk in more detail about them later. Um, yeah, we have many options for that kind of thing. And then in terms of muscle cramping, so that was a question that came up. So there can be different causes and reasons for muscle cramping. Obviously, there could be some electrolyte balance in terms of, wanting more magnesium or potassium in the body. There could be simply a lot of tension for different reasons. Could be stress, obviously, but definitely making sure you're hydrated, having a good electrolyte balance, that's a good start, and stretching is a good start. But in Chinese medicine, we have this additional concept, which is called blood deficiency. So even if your blood counts are fine, we can still think that you have a little bit of what we call blood deficiency. If you have some dryness, pale tongue, maybe you see some floaters, you don't sleep well, you startle easily, we have, and then you have a little bit of aches and pains. Sometimes there's what we call blood deficiency, and that can also cause muscle cramping. So sometimes the benefit of Chinese medicine is also to have an additional lens as to a problem. You've already maybe gone to the doctor and all the basics are covered, but maybe there's an additional way of looking at what is happening in your body. And Chinese medicine is really just an alternative diagnostic lens where we look at all of the aspects of your body, your digestion, your sleep, etc., and we form our own Chinese medicine diagnosis that can be quite helpful. The third S, and I do see the additional questions, so I will address that as well. Okay, so the third S is about slowing cancer growth. So I can talk a little bit about that as well, but basically there are some research studies that show an association between longer life expectancy after cancer treatment and longer use of traditional Chinese medicine herbs. So typically in China, a cancer survivor would continue to come in and take herbs for at least 3 years after. And that would be, to retonify the body and address some other factors that could be affecting the person's health in terms of reducing their risk of recurrence. So those factors might be improving their sleep, improving their digestion, lowering their stress, lowering their overall inflammation, just optimizing all those things. So we really think very preventatively in Chinese medicine, and that's why we're looking at a lot of details with the health. So you may be in the normal range from a biomedical point of view, but we look at a lot of like, well, is your is your stool, like are there little bits of food in it? And how easy is it to go or hard is it to go? Is it a little bit on the softer side? Maybe your digestion's not fully strong enough. Okay, so let me just take a little pause here and address some of the questions. So, I think I addressed some, but in terms of, okay, neuropathy. So yeah, so this is a perfect slide for this because this on the bottom right is a screenshot of a paper that I published recently with a few colleagues about breast cancer survivorship in particular. So it wasn't just Chinese medicine we looked at, but other natural and integrative medicine approaches. So integrative medicine is basically other things that are not just like the conventional approach of your typical doctor that you see in the hospital. So there might be, naturopathic medicine, homeopathy, herbal medicine, Chinese medicine, etc. So that's kind of massage therapy, meditation, yoga, all these things are kind of lumped into integrative medicine. So we wrote a paper about that specifically with regard to breast cancer patients. Um, after active cancer treatment. So yes, in terms of neuropathy, that is one of the frequent issues that we see, especially after like paclitaxel, carboplatin, like there's a lot of the different chemos that are used in breast cancer. Because I think, well, the question was about trastuzumab, so I guess I assumed it was likely about breast cancer, tamoxifen and trastuzumab. Um, so yeah, we do see a lot of neuropathy patients, and they do tend to improve with acupuncture. There's some other, if we were working virtually, you may be able to use herbs, acupressure as well. But it is okay. It's definitely okay to use acupuncture while on tamoxifen. I have a million patients, not a million, obviously not a million. I have a lot of patients who are on tamoxifen or on trastuzumab. It is helpful if you can see someone who at least knows about cancer, just for safety reasons. So typically, we just want to make sure we're keeping an eye on um, where the active sites are in the body. If there has been any metastasis, for example, we want to keep an eye on blood counts, etc. And if that person's going to use herbs, especially, then we want to be, aware. If it's a hormone sensitive cancer, then we need to be aware of the potential hormone effects of the herbs. So let's see. So that kind of leads into Issa's question about not an herb, but discussing nutrition after breast cancer. Can you comment on the conflicting information about soy? So yeah, so soy, oh, and animal products as well. So soy got a bad rep, for many years when it came to breast and other hormone-driven cancers. In terms of actual soy foods, that has basically been disproven. So more recent systematic reviews would suggest um, that whole soy products, edamame, tofu, tempeh, soy milk, but obviously preferably in non-GMO form, organic form, etc., are actually on a population level beneficial for breast cancer prevention and for other hormone-driven cancers. So now the recommendation is that you can eat these, I mean, moderate, like you're not only eating these things, right? But if you eat them at a moderate level, populations who do eat whole soy products actually have lower rates of these types of cancers. However, what is not recommended is soy extracts. So processed soy products or buying a lot of those, protein powders that have soy isolates and things like that, that's not generally so recommended. So I think there's a lot of confusion and fear around so-called phytoestrogens, and that continues to exist. That's like plant-based plants that can affect like our estrogen receptors. There's a lot of like concern that that can make cancers worse that are estrogen sensitive. But that doesn't seem to be the case with eating whole soy products. So I hope that answers your question, Isa. I think we'll probably find similarly for many other phytoestrogens in the future, but it's just, who has the funding to do wide population-based studies on all of the phytoestrogens, but what we do find, and I'll mention because in terms of the studies around survival, like basically longevity, um, all of the uh, all of the studies around longevity and breast cancer patients and Chinese medicine herbs tend to see better longevity when you're taking those herbs. And dongui, which is one of the most common phytoestrogens, is in the most popular breast cancer formula used in Taiwan, which is where these studies were done. So again, I think it's how you combine it and how you use it. So it's important to work with an herbalist who knows about these things. If you have concerns about, especially about hormone. Um, but yeah, herbs do have side effects, so let's keep that in mind. I will talk about some of the common herbs we use in Chinese medicine later, but it would be, of course, still better to work with a professional if you can. Okay, and then um, okay, I think so acupuncture for headaches. So headaches and many other types of pain do tend to respond quite well to acupuncture. Headaches can be complicated. So there are many other causes of headaches. It could be hormonal, there could be dehydration, there could be stress, there could be muscle tension. Like if it's based on muscle tension, that tends to respond quite well. For the other things, we kind of have to suss out the pattern of the headache. But generally speaking, if the diagnosis is correct in Chinese medicine, we do usually see improvements with headaches and migraines as well. Um, yeah. And then, yeah, in terms of headaches and migraines, I should mention too that sometimes we do need the herbs. So if it's not just a muscle tension issue, if it's a bit more complicated than that, then I would also use herbs. And sometimes I actually mainly use herbs because there's a lot of herbs that help with headaches. Okay. Okay, so this slide is kind of continuing this theme of that there is ongoing research and then some of the benefits. So, um, this one on the left is about depression risk and how using Chinese herbal medicine lowered the depression risk among breast cancer survivors in this study. This other study in the lower left talks about quality of life and cancer-related fatigue, as well as cognitive symptoms, which most people know as brain fog. So post, cancer treatment, many people may experience fatigue, brain fog, etc. And it's saying that in this trial, they found that there was generally speaking a benefit to using the Chinese herbs. Yeah, and then this one up here in the top right, again, is another example of the Taiwanese like population-based studies associating the use of herbs with better longevity. Um, okay, what herbs can help with headaches? There's many herbs that help with headaches, and you probably haven't heard of most of them, but I will type some of the opinion into the chat in case you have. Uh, mm, oh, there's so many. It really just depends what type of headache, you know? Okay, I typed a few there. Okay. So as I was mentioning, in Chinese medicine, we kind of look more at the whole body as a garden, and how we can balance that. So in the survivorship phase, and that can also include like managing cancer as a chronic disease. Um, then we're really looking at what are the factors that are affecting the terrain. You might have heard about this if you've attended other sessions with like nutritionists or naturopaths who work with cancer, that we talk about the terrain. That's kind of like the soil. Why is the cancer growing in that soil? So in Chinese medicine, we actually have some theories about um, the factors that can contribute to the growth of cancer. And I'll just mention them. Obviously, this is a very introductory seminar, but just to give you an idea of what we would be looking at. So, number one, typically for cancer to grow, there is some kind of like um, we call deficiency or weakness in the body's own chi, like the body's own life force energy, or you can think of it as the body's natural resistance or immunity. So you may have heard of this concept that there's like always cancerous cells, mutated cells like floating around our body, but typically ideally the immune system is catching them. Um, but if the immune system's maybe not, it's not quite right, then it may have missed that. So some of the therapies now are looking at, the immunotherapy basically is looking at regulating the immune system to fight cancer. And in Chinese medicine, we've had this concept for a long time. So a lot of the ones we mentioned earlier, ginseng, astragalus, reishi, etc., chaga, all the medicinal mushrooms, they actually, many of them have undergone a lot of research, promising research for their beneficial effects in cancer prevention. Um, Secondly, we look, and then, sorry, some of the things that can manifest when there's qi deficiency include fatigue, like we talked about, and it can actually be related to digestive issues as well. So when our qi is very low, often our digestive qi is low too. That means that our bowel movements aren't quite right, or maybe we have a low appetite or unregulated appetite, more prone to nausea, reflux, bloating. Things are not really processing well, and that can often happen after active cancer treatment. And we want to address that because in Chinese medicine, that's a big source of your body's energy. In Chinese medicine, we believe that for cancer to develop, there's some kind of stagnation of qi and blood, so poor circulation of energy or blood in a certain area. Um, we also believe there's some phlegm damp, which you can think of as a kind of inflammation. So it basically means that the fluids aren't quite being processed or metabolized as well as they should. And that can manifest in a lot of different ways. But you can think of it as inflammation. And then toxin. So there's some kind of element from the outside. You can think of that as like exposure to a carcinogen, or a virus or bacteria that may have been implicated. But there can also be unknown toxins, or there can be like toxic emotions. That's what we believe in Chinese medicine, is that something that is held onto for a long time can actually become toxic. So I just want to touch on a little bit of like tips, and these are just everyday tips. So again, very general, but just giving you an idea. So when you have Jiangqi deficiency, again, you may have fatigue, you may have weak digestion, you may be on the anemic side, that kind of thing. We want to be thinking to eat warmer foods. We want to be chewing more slowly. Um, and thoroughly so that we can absorb properly. We want to really focus on nourishing foods. You'll see down here, for example, there's a couple of herbs that are actually foods. So, for example, goji berries became very famous several years ago as a superfood, but they were used as a Chinese herb for many, many years because they've got a very high concentration of nutrients. And you can think that about kale or like that kind of thing. Just very high nutrient dense. This is lianzi. It's another food that we often use in Chinese medicine. These are Chinese dates. Um, this is astragalus root, which we can boil them into soups too. So this particular herb, it can be boiled into soups, and then the mushrooms can be used as teas. So very, very nourishing foods can be helpful. Keeping warm can be helpful if you are on the cold side. We actually believe that keeping warm is more important than many people here think. So, one of my first Chinese doctors complained that people in North America don't wear long johns because we spend too much chi just like fighting the cold. And a lot of my patients come in and they have cold feet. They have very cold legs and feet. And we do believe that expends some chi. So there's a lot of sort of avoiding cold or raw foods or avoiding cold winds and things like that. So dressing properly, not being overly exposed. Practicing qigong again, a very good way to strengthen the qi. Doing moxibustion on certain key acupressure points. So that is when we burn mugwort, which is a certain herb, over those points. Um, yeah, so here are some examples of qi deficiency tending to cold, some of the symptoms, and in terms of eating, so these herbs that I've mentioned below, as well as, a kind of like porridge, congee, it's very easy to absorb. You can have it with a broth, and then ginger as well. Hold on, there's a question. Turmeric as an addition to food or in supplement form while on tamoxifen. My integrative doctor told me supplements were fine, but everyone else says no. Okay. Okay, yeah. So why don't we talk about that? So, the specific combination of turmeric and tamoxifen, I usually look up. So I run all my formulas through a herb drug interaction checker. So I don't want to like give you just information off the cuff without double checking. Um, but what usually happens in Ontario, because we're in a fairly conservative part of the world when it comes to plant medicine, is that oncologists and pharmacists they don't know a lot about the herbs and they're very cautious. So often they will say no, or the oncologists now, especially at like Princess Margaret, they often now tell people to just bring the list to the pharmacist, and then they let the pharmacist decide. Um, there is limited information, really. So there are some case reports about potential interactions. What we can look at are things like how the herbs and drugs are metabolized, and that, can give us some information about whether or not they may affect each other. But then we can also look at studies. And like I mentioned, there are quite a bit of studies that show that integrative medicine, like if it's done properly, um, people who just like say they won't do what the doctor says to do and they'll just do their own thing and then they look online and they take whatever they read online. Like there are studies that show that that doesn't usually lead to great outcomes. But for people who are, prescribing these integrative um, medicine interventions on the basis of like information, like evidence informed prescription, that tends to improve people's outcomes. So it usually does better, that people do better than they would have if they did nothing else, no supplements whatsoever. However, the oncologist and pharmacist may not tell you that. So I don't know what I'm allowed to say in Wellspring or not. But when you come to me as a patient, I will say, like, my scope of practice, of course, I can only advise in my own scope of practice. I can't tell you to listen to or not listen to your oncologist. But I do know they don't have much training in this. And there are a lot of ways to research herb-drug interactions. So if they are quite concerned, I can provide them with information and research studies if they're willing to consider them. Often they don't really have time to consider them, but I'm happy to provide that for the people I work with. So hopefully that answers that question. Let's see. Just a couple quick other questions for insurance. Do you bill TCM under acupuncture coverage? Yes, usually. So I don't really bill because I don't do direct billing, but when I provide the receipt references like services by registered acupuncturist and services by registered traditional Chinese medicine practitioner. You can contact me after if you have more specific questions about that. But yeah, that's a quick answer. So yes, typically it would fall under that because for most benefit plans, they don't cover, herbalism or anything like that. And then floaters in the eyes. So floaters for us is, I mean, again, there could be different reasons for floaters, but if the floaters, there's no actual eye problem, and they're just like little dots floating around and they're not actually anything your optometrist is concerned about. Sometimes in Chinese medicine, that's a symptom of blood deficiency. And when we use some blood tonics, then those can improve along with other blood deficiency symptoms like sleep or palpitations or, things like that. Okay. So there are some cautions. So there are some herbs you may have heard of, like ginseng or cordyceps, which is a type of medicinal mushroom, and these can be quite energetically warm. So if you're the type of person that gets, a lot of hot flashes or things like that, and some people, there is some belief that ginseng is a potential phytoestrogen. So typically, I avoid ginseng proper when I'm doing herbs for hormone sensitive cancers, but there are some substitutes that I would use instead. There are some cautions around some of the other herbs I mentioned, so astragalus, rhamania, goji berry, etc., may cause a bit more bloating. Or if you have a lot of phlegm damp, like if you have a lot of mucus, if you're the type of person that's blowing your nose all the time, or you have a lot of acne with whiteheads or something like that, then maybe we need to get rid of some of the phlegm dampness first before you take some of these tonic herbs. So just, be careful. Here are some foods that can help deal with the stagnation of qi in blood. So we do mention turmeric here as an option. I'm kind of gonna not spend a ton of time on all of these, but I'm happy to share my slides with you, if you email me afterwards. I'm just giving you an idea of, I want to make sure I get to all the questions basically. And let's see, tight muscles. I don't know if I mentioned, but yes, so tight muscles, so stagnation of qi and blood. This is one of the common factors we see in most people, honestly, but definitely is there when cancer has developed. And when there's stagnation, there often is pain or tension. So acupuncture is very well known for pain. It's actually now commonly recommended by the American Society for Clinical Oncology in their integrative pain management recommendations. They mention acupuncture all over the place for all types of pain. Neuropathy, as we mentioned earlier, neuropathic pain with like numbness, tingling, burning, etc. Joint pain for that goes along with aromatase inhibitors, like the hormone suppressing drugs that many people take, that can result in some joint pain. It's very commonly recommended for that, as well as for muscle tension, cramping, has headaches, etc. So just making sure that I'm addressing all these questions. Any solution with TCM for vivid nightmares and waking panic? Yeah, so the effects of Chinese medicine for mental emotional symptoms Hasn't been, I don't think, as well documented, but there are some studies, as I showed you, there's the one about depression. So we do know for sure there can be benefits to various mental emotional issues, including anxiety and panic, including poor sleep. So for us, poor sleep doesn't just mean lying awake. It could mean dream disturbed sleep, nightmare disturbed sleep, difficulty falling asleep, staying asleep, etc., quality of sleep. So, all of these are things that there are various herbal formulas in Chinese medicine to address, and that also sometimes acupuncture can help with too. So, I work with people on this sort of thing a lot, and typically we can get some good results. If there is, for some people, there may be a need to address some post-traumatic stress. So especially, having been diagnosed with cancer, going through the treatment, that's a very stressful experience. For some people, doing some physical therapies like acupuncture, like acupressure, and the herbs is enough. Many people have benefited from that and they don't need anything further. But for other people, that kind of traumatic aspect of the experience is quite deep and quite emotionally or psychologically deep, and they may benefit from, more like focused psychological support from a psychologist or a psychotherapist. I will say that I refer to psychotherapists a lot. So depending, it can certainly help. And sometimes psychotherapists refer to us because they realize the person also needs some, nutritional or other physical supports in addition to the emotional work that they're doing together. Okay. Yeah, so in terms of helping with stagnation, the management of emotional stress, which can again include counseling, art, meditation, etc., professional support can help. Um, Exercise, of course, is also excellent in all aspects of survivorship. Okay, so phlegm, that would be the aspects of inflammation that we talked about. And this is going to overlap actually. So a lot of the Chinese medicine wisdom around what types of food can generate excessive phlegm damp overlaps with the types of foods that are seen to be pro-inflammatory. So, you've probably been through some of the nutritional programs that talk about, Mediterranean style diet and eating anti-inflammatory, cleaner oils and less refined carbohydrates and things like that. Um, so, and of course, alcohol. So, a lot of these in Chinese medicine are known to create damp phlegm. In addition, some kind of like greasy, fatty foods and cold foods as well. Oh, I didn't write that. I meant to add that. So again, in Chinese medicine, we do usually suggest having warmer foods because cold temperature and some excessive raw foods, if your digestion is weak, can actually unfortunately increase some damp phlegm. So if your digestion is weak, we do suggest sort of cooking your food. And then if you do have really a lot of excessive inflammation, there are some more, extreme dietary measures, like different types of cleanses, things like that can help. And then I've listed some foods here that can help with that stuff too. So for a lot of people, they may find some different beans to be helpful with excessive phlegm damp, as well as things like radishes, asparaguses, and the different mushrooms as well. Okay, and then this is the above suggestions were for people who have a lot of phlegm dip, and which is, you know, um, you may find it a little hard to assess yourself, but for us, if you're very dry, you have no signs of mucus, you're more on the thin side, um, and you're kind of more weak, then we wouldn't just don't do too much phlegm clearing because it can be a little bit depleting. Okay, and then in terms of minimizing our toxins, of course, there is also going to be a lot of overlap with other non-Chinese medicine approaches to improving your environmental health. So just looking around at the environment around us. Really good website for this is the Environmental Working Group. So I often will put this in my treatment plan for people. They have a lot of very user-friendly resources for choosing, shampoos and water filters and things like that. Um, yeah, so we do suggest using a water filter because there are a lot more contaminants in our water than we think. And then in terms of minimizing pesticides, which can act as, estrogens, um, you can especially look at the organic versions of like the Dirty Dozen. So usually every year, the Environmental Working Group, the link I just put out, they'll put out a list of kind of the dozen or so fruits or vegetables that are the most contaminated with pesticides, and then the clean 15 that it's pretty safe to buy conventional versions and you won't get a lot of pesticides on them. And then just some of the herbs are here as well, so we might throw some of these into your formulas as well. So you may have heard of some of these or not. So skullcap, Chinese skullcap is sort of famous. Coptis root and skullcap both have um, berberine. You may have heard of berberine as a substance that helps with blood sugar control and antitoxin. And some of these herbs are frequently found in the breast cancer formulas in some of those studies that I've mentioned. So they're all being researched for their anti-cancer effects, but should be used kind of in moderation as well. Oh, the Dirty Dozen was just released today. Thank you, Isa. Okay, so just to wrap up, because again, I try to make it like uh, clear that in an ideal world, like you'd get a customized formula. So this is the type of thing I would consider like where's your cancer located? Has it metastasized? What type is it? And then what's your constitution? Are you more cold type, hot type in Chinese medicine? Are you more a weak type or a overly robust type? How much qi deficiency do you have? And then what are the goals of the formula? So why are you wanting the formula? Is it post-surgery and you want to recover? Is it that you are looking for recurrence prevention only? Do you have neuropathy? Like, what are the goals? What are the signs, symptoms, and discomforts? What are your quality of life concerns? Do you want to sleep better, etc.? And then herb drug interactions, of course. So making sure that everything is safe, as safe as possible. Other biomedical considerations like hormone sensitivity, um, comorbidities, if the person has high blood sugar or high blood pressure, that can help to determine as well. Um, there's some contraindications for some of the above reasons. And then also, what else are you taking? What are the side effects? And how can we offset those side effects without interfering with your conventional treatment? And we'll also look at modern research. So there's a lot of research right now into each individual herb and their effects on different types of cancers. So there's just an example, like after chemotherapy, this is a person who had what we call qi and blood deficiency. They were very tired, had a poor appetite, loose stools, dry eyes, pale tongue, usually cold, weak legs and knees. They had trouble with skin healing. In particular, they had chronic skin ulcers, and their tongue was pale but a little bit purplish, and a thin white coat with a thin, weak, deep pulse. So there's just an example of, a case and the formula that was designed for that person. Um, And yeah, I would say that probably out of all of the patients that I observed in China post active cancer treatment, they typically took tonics like this and usually did feel much better in terms of their energy afterwards. So a lot of people would come back and just, maintain their energy that way. Okay, that was very quick. I hope that I've addressed all the questions. you can certainly um, drop more into the chat if you wish. Oh, I think there's a new one. Okay. Um, Soursop. So soursop is not a traditional Chinese medicine herb, so I can't really comment on soursop. Um, Heard good things about it, but again, I don't know anything about it, so I can't really comment. Fasting can be beneficial for sure. There's increased research into fasting, and in Chinese medicine, we do different types of cleanses in terms of fasting, but then we have to look at the person again, because sometimes after cancer treatment, if it included something like chemotherapy, to some extent radiation, but mostly something like chemo, the person might be quite depleted. And while fasting, there is some evidence that fasting during chemo can be beneficial if the person is at a kind of more frail state and almost a malnourished state after chemo, because it can affect people's ability to absorb and digest, then fasting might not be the best approach for them. So again, we kind of look at in Chinese medicine, we call it like, are they an excess type or a deficiency type? Like, are they more weak and need, building up with tonics? Or are they more like excessive, too much heat, too much dampness, and maybe they would benefit from a more cleansing approach? And fasting would count as a bit of a more cleansing approach. Yeah, so if you would like to email me, thank you, AJ Pal, for putting that in, then I'm happy to give you a copy of the slides. And I forgot to mention last time that I do have this very occasional newsletter where I will send announcements of webinars like this and other free kind of like events and resources. So I'm hoping, for example, like sometime in the next year to offer some free or pay what you can mindfulness kind of sessions and other things like that for people with cancer. So you're welcome to stay in touch. Yeah. Any questions? Any other questions?
Hey Pauline, I have a quick question. So the last slide that you were sharing, you created a combination of herbs for that individual. These herbs don't have any side effects, right? Because it's all natural stuff.
Oh, no, they do. They can. So, um, yeah. So, yeah, if you take any herb, if it's not suitable for you, it could have a side effect. So, let's say you have a lot of heat in your body, and then you take ginseng. You could end up with too much heat in your body.
Okay.
Yeah. So, um, in Chinese culture, a lot of people will take some of these more food grade tonics that you can boil into soups, like let's say the Chinese yam or the astragalus root, they might put it in a soup. And for someone who like obviously is kind of weaker, more fatigued, etc., it's probably not the end of the world to eat it as a food. But when you're taking this as an herbal formula, that means you're drinking it twice a day, every day. So it's at a medicinal level versus at a food level. I think to take some of these things as food, put medicinal mushrooms as a part of your tea rotation or whatever, licorice root, as long as you don't have high blood pressure, could be part of your tea rotation. But to take the same formula every single day, that's actually quite a strong medicine. So you may want to like get some professional assessment and guidance before you go ahead and do that on your own.
And sorry, one more question. I know, I saw it on
No,
social
go ahead.
media, of course, and I bought red ginseng, and maybe it's just a commercial form, but like the red box, whatever. And this was like pre-cancer, and it's just sitting there, and I'm like, I don't know if I should take it. Like, I'm just like very cautious now about what I'm taking inside now. But anyways,
Yeah.
I think I got in touch with you after that other session you did
Oh,
last time, stress.
you
And
did.
I just shoot you an email, so we'll definitely get in touch.
Oh, okay. Okay. It's like, did I
Uh,
respond? Okay,
you
great.
did, and I lost, so I like
Oh,
just
okay,
like
okay.
yeah, right
Okay.
now during
Yeah,
this semester.
red ginseng is one of the ones I would be a little more cautious of
Oh,
because although it is commonly available as a food, it is just like quite warm. Whereas there are some herbs that are more neutral. Like they're not as warm, just like let's say reishi mushroom. It's not as warm. It's a bit on the warm side, but it's not gonna like heat you up that much, but like red ginseng could really heat you up.
okay.
So, and then also, depending if there's a hormone sensitivity to the cancer, it is one of the ones that's kind of flagged.
Oh,
Although
okay.
again, I think
That's
there's
the
some
one I have.
question marks around the phytoestrogen, how that's going to pan out, but it is currently one of the ones that's flagged.
Okay.
So there are some cautions around red ginseng.
Okay. Thank you. We'll get in touch for sure.
No problem. Any other questions? I think I missed one. Where do you recommend one starts to look for TCM? Okay, so there is a college, so the College of Traditional Chinese Medicine Practitioners and Acupuncturists of Ontario. That's the acronym. They have a website. You can look up practitioners there if you wish. Um, yeah. So just they don't all like necessarily have a lot of background about cancer, but you can certainly look for someone local there. And again, if you wanted to just do a 15-minute free consult with me, I'm happy to chat and see if you would be fine with just getting some virtual help, or if you really need to see someone local, then I could, suggest potentially I know someone who's close to you. So yeah. Yeah. So I guess just to conclude, it is possible to do these assessments and develop treatment plans and herbs and things like that virtually. So that can happen across Ontario or beyond. Um, and I'm happy to do a free consultation if you have those types of questions. Any other questions? Okay, I think I addressed them all.
I think you did.
Okay.
Yeah. Cool. I'll go ahead and stop the recording.